This idea just came from a conversation with myself and the medical director of care here, Dr. Errol Sequeira. We just sat down and thought to each other, we just want to improve care. And how can we do that given the technologies and resources that we have? And ultimately, we came up with this idea of having internal medicine doctors coming into the home and seeing patients, and also using virtual care when patients were decompensating in real time. Many of these residents have cognitive impairment issues, so keeping them out of hospital and having them in the comfort of their own home and seeing them here rather than internal medicine physicians seeing them in the hospital really reduces the risks of so many different hospital-acquired complications. So I think that was the ultimate reason why we wanted to do this. And it's kind of like having a conversation, a video call, where the patient is there and you can visualize them. The nurse is also there. The patient's families are usually in the picture as well, so you can talk to them. And then I'm sitting remotely kind of assessing this patient, getting some data points like their blood pressure, their other vital signs and symptoms and their medical history, and then ultimately making a decision and providing recommendations back to the family physician.
So the residents and the families, they were very impressed by having this program. A lot of them are very wary of having to send their loved one to the emergency department. They feel that having improved access is really important for them, and knowing that they're connecting directly to the doctor is really important.
My wife, Margaret, she was 89. She was the love of my life, so I came every day to see her. It's rewarding that you can see that something's being done, and it saves all the disruption of moving somebody out of their home. This is their home when they're here, and if it can be done without that problem, that's good.
We were fortunate to have a decrease in about 50% of transfers when we introduced this bundle of care. At the same time, we were also monitoring safety, and I think that is huge. So if I were to recommend that if a resident was not transferred, we would monitor that patient for 24 to 48 hours after to ensure that we actually had made the right call, so that that resident was actually not transferred inadvertently. I think that just having that extra access and that extra touch point is something that really provides families with a sense of comfort. And that's really what we're doing here. Improving care and improving that sense of comfort for family members. I think that's really revolutionized the way in which we practice medicine.